So what we're going to do is look at nasal flow and nasal pressures. And that's what creates nasal resistance. The nasal resistance is what predisposes you to different diseases. So we can measure this objectively. Typically, we ask patients questions that they can breathe through their nose. Now we have a way to objectively measure it. So we use what's called 4-phase rhinomanometry. It's been around for years, but in the past 7 years, it's been updated into a 4-phase rhinomanometry. So it's more detailed to allow us to look at pressure flow, pressure changes over 4 respiratory cycles. A lot of good information there will tell us about the tongue position, how much activity the tongue has in the nasal resistance. It'll allow us to look at nasal valve phenomenons, as well as nasal valve collapses. And a nasal valve phenomenon, you can't see it to the naked eye, but we can see it on what's called a tracing on the graph. So that's rhinomanometry. Acoustic rhinometer sounds very familiar. That's a pulse wave that comes out of a sound tube and will bounce off of the nose geometry so that we can see where an obstruction is located. But it's very important to understand that it's not one single obstruction in the nose, but the whole entire accumulation of obstruction that's affecting the nasal function. And we use this in what's called, what I've termed with Dr. Vaught as functional rhinology, functioning nose. That's so important because a daytime nose is not the same as a nighttime nose, because that pressure and resistance will increase naturally when you lie down to sleep. And this is why it's so important to keep the nose open. Now, we're going to look at this, but we have to understand that the first port of resistance that we see is right in the first 1 inch of your nose. That's the highest point of resistance that we can see. And it's also higher when we breathe in. That's why we like to use nasal dilators, especially intake, because it's a fixed band that will fix the structure to keep it open. So we're going to perform a test. What I'm going to do is put a nasal foam into the right nostril and capture the flow of the left nostril. And look at that against a particular pressure gradient. That's how I'm going to measure it. So the test itself is about 15 seconds long. Once that's done, I will move the nasal foam to the left side, and the same thing will happen. And we'll place a mask over the face so that we can capture all of the pressure changes. We do it with the mouth closed, and we strictly look at nasal function and breathing. So let's get started. It's going to expand a little bit, and then I want you to pinch the left side to see if you have a good seal. Now, there's 3 different sizes of foams. There's a peach colored for kids, and we can do this in kids as young as 3 years old. In fact, they do this in Europe and Asia in young kids. Then we have a standard size, and then we have a larger foam size. What I want you to do is place the mask gently over your nose, right there. Keep your mouth closed during the test. You have a good seal? Okay, and we're going to get started. I want you to sit up straight because that's how we like to breathe. We want to when you have problems breathing over time, your body will begin to compensate. And it compensates by bringing your head forward. So we're going to go ahead and go, and you're ready? Let's go. See how we have. Just breathe in through your nose normally, nothing fancy. The test itself takes about 15 seconds. And the other nice thing is that this can show us a predetermination to sleep apnea. In sleep apnea, which is when you stop breathing, take the mask off. We're going to move the foam over to the left nostril. And it is not uncommon to have one nostril larger than another. And we see this often with a deviated septum or a nasal valve problem. Now we're going to capture the flow on the right side and measure it against a pressure gradient to create resistance and see how much is built up in the nose. And there's already natural pressures in the nose. Okay, mask up, sit up, and let's go. Again, we're waiting for the measurement of the nasal resistance to pop up. It takes about 15 seconds to calculate. So when I look at the test, you can see how the right deviated septum, I see the right side here? Mm-hmm. See how lower it is to this side? See how uneven the X is? Mm-hmm. This tells me I see a right deviated septum. I also see a nasal, like some of a nasal valve issue. So because the deviated septum and the presence of a nasal valve phenomenon, the air is being rerouted to get into your nose. So air follows the path of least resistance, just like water. And it finds a way in so that we can breathe efficiently through our nose. But when we have an obstruction, specifically a nasal valve problem, any problem here at the external nasal valve or the internal nasal valve, that creates an issue to get our air into our noses. So when I see this, the right side is worse than the left side. But upon examination, and I do what's called the Maverick nasal exam, which I created, and I go through each letter of Maverick to tell me what I could see on the rhinomanometry test. So what I see on the rhinomanometry test and what I see physically on an exam should match up. And to that end, rhinomanometry tells me there's a right deviated septum, and there is. And if you look under the nose, you can see the right nostril is asymmetrical to the left nostril, and that's a cue. Next thing I'm going to do is a nasal dilator. So what I do next is I want to see if something conservative can help long before surgery. And what I typically do is I try to see if there's a mucosal problem. Is there swelling in the nose that could be treated with something like an X-Clear, xylitol, a homeopathic spray. I also will use a nasal dilator, and I like to use Intake. That's my preferred brand. Why? Because the band is a fixed band. It doesn't allow the lateral walls of the nose or the outside of the nose to move when we're breathing. I like the amount of pressure that it puts on those sides of the nose so that it's fixed and it remains stayed for better breathing. So we're going to go and do a rhinomanometry test with the intake band to see if the breathing can improve and the resistance can drop. So we're going to repeat what we do. Alrighty, so that's our baseline. I'm going to go up here. I'm going to start a new test. Are you ready? Mm-hmm. Make sure you have a good seal. Sit up straight. Beautiful. All right, we're going to switch over to the left. Do you need a new foam? Is it still good? Up straight. We don't want any compensation. And here we go. Do you see what intake did with you?
Crazy.
It worked.
That's crazy.
It worked. So on my left side, you see how it balanced out your breathing?
Yeah.
Look at your breathing pattern. When I look at the maximum deviation, I want to see closer to 0. He was at 0.838. And with intake, he went down to 0.067. His breathing pattern was more consistent and improved with intake. Another note, nasal resistance on the right side, which was the worst side, decreased. But what happened was the left side was good, and because it was good, it had a little bit higher resistance because it's trying to balance out. But my point is that the nasal resistance on the right and the left side became more balanced. So that tells me I can do intake with this patient and I can do a homeopathic spray if there's any type of allergy or mucosal problem. So again, breathing pattern is more consistent with intake. Intake dropped his nasal resistance on the right side. That was a deviated septum that I saw. And I would say keep doing this. And what size do you have?
M1.
So that's with an M1. Now, if I were to go up in another size, which I've done studies on, that can have a reverse effect. So this is where size matters. Not only from here on the outside to here, but also on your nose. And with him, what I would do is have the band on the worst side go up a little like we did, because that will change the nostril size and make it a little bit more symmetrical to the good side. And there we have it. Breathe easy, sleep well.